2009, Fortis Healthcare Limited acquired 10 hospitals from Wokhart Hospitals Limited, which was basically the hospitals which Wokhart had, which were self-owned by Wokhart, fundamentally in the cities of Bangalore, Bombay and Calcutta. And these were 10 hospitals which were 8 functioning units and 2 large hospitals which were in the pipeline and projects in the pipeline. Total bed capacity of almost close to 1,300 beds, and which included our 4 hospitals which are currently in Bangalore, the 2 hospitals which were in Calcutta. There was one more which was coming up in Calcutta, the 2 hospitals which were in Bombay, one in Mulund and the other one in Kalyan. And also there was one new project which is currently coming up in Bangalore. So total of 10, and fundamentally the entire almost 80 to 85% of the turnover of Wokhart Hospitals Limited actually got into Fortis Hospitals Limited. I think fundamentally 2 very clear-cut factors. One is around accessibility, and which is true for India, which is very, very true for both modern India and which is the urban India, and also for the evolving India, which is the semi-urban India. And the other one is fundamentally the availability of infrastructure. And India is an evolving country. We are a rapidly developing country, but our healthcare infrastructure has not kept pace with our overall evolution. So there is a huge demand-supply gap in the beds. And so therefore, I think we need to fundamentally see that how the patient population in this country can get easier and faster accessibility, both from the perspective of affordability and from the perspective of availability of technology and infrastructure and clinical acumen. I think fundamentally when you look at technology and when you look at information technology, I think information technology has become a very core element of running a healthcare enterprise. And the way that we have looked at it as Fortis Hospitals was fundamentally, one is from a pure patient services perspective. So it's, earlier it used to be just about patient's admission, discharge, transfer, and that is where technology started and finished. But today at Fortis, we are basically looking at it, a connection between offering the entire gamut of patient services, connecting the clinical component to it, and then also connecting the post-discharge connectivity of patients to the hospitals. And so, while we continue to ensure that patients who are inside the hospital are getting the best usage of information technology from the way that we connect our medical technology to our services, but also from a discharge point of view and how they are able to continuously interact with us and connect with us through our websites and through our continuity of services is equally important to us. So the way that we look at IT today at Fortis Hospitals, it's fundamentally around how we can create better efficiency in order to create a much higher level of patient care and patient satisfaction. Although, most of, in fact, all our hospitals have very modern HIS systems, which is the hospital information systems. But I think we still have a way to travel in terms of, because IT is evolving continuously, and I think as healthcare enterprises, we need to evolve at an equally fast pace. Our next big challenge is how we can network all our facilities together and basically use information technology and the backbone of information technology to connect our various hospitals to create a seamlessness of hospital services to our patients. So I would assume that we are probably today at 80 to 85% of utilization of information technology, and there is still that 15% to go in terms of creating a better connectivity. But from a hardware perspective, from a connectivity perspective, from using a very strong back-end support system of finance and hospital operations, it's all already there. See, basically ISRO has a very strong focus on telemedicine, and one of the areas that we have worked with ISRO is fundamentally using the bandwidth available through ISRO and connecting some of the 2 or 3 centers which we have in the rural and the semi-urban areas. I think there has been a huge issue in terms of the availability of bandwidth to fundamentally get the optimal usage of telemedicine within the country. And we expect that now with 3G getting enabled, we would be able to take that step forward and we would be able to maximally utilize the availability of bandwidth for telemedicine and linking particularly our intensive care units to our doctors from wherever they are. I think in the past it has often so happened that because the IT team has always been, as you just said some time back, that many times corporations thought of IT as a tool, so the IT team was sitting somewhere with all this technology and not getting integrated with the rest of the business. And then these tools are not only just getting expensive, but these tools are also evolving at a very, very fast pace. So I think the basic fundamental of my expectation from the IT team would be that they need to sit down with the rest of the business, look at both the internal and the external customer, see where the efficiency can be created, see where the business is heading, and how they can actually create an impact in not just the faster growth of the business, but in a more efficient growth of the business. So I think today we consider, and to me, the CIO of the company is as important as the CEO of the company. And I would look at it fundamentally from that perspective. I think we need to look at IT today when we start a new hospital. Earlier, 10 years back, when we would start a hospital, IT would be thought of after the hospital had got. So if you look at 10 years back and you look at starting hospitals 10 years back, IT was thought of after the physical infrastructure was ready, after the medical equipment had come in, and that's when we started looking at what kind of IT solutions you wanted to put in place. Today, when we look at our new Calcutta hospital, which is going upstream, in the second week of August, we actually thought about IT when we dug the ground, because the cabling has to be started, the entire IT vision of a new hospital has to be put in place when you're actually conceptualizing the project. So, when you look at that, today an IT spend on a new greenfield project can be anywhere from 5 to 7% of the overall cost of the project. And on an ongoing basis, just the same way as we look at the regular CapEx spend on medical equipment and on upgradation of our current facilities, we need to look at IT as a part of that 1 to 2% of regular CapEx of project cost, which is going into constant upgradation. So today, I think it's essential to look at IT not just from a one-time spend perspective, but from a continuous spend and also from a continuous upgradation of the infrastructure. I think we in the healthcare industry have probably not maximized the use of information technology. And even today, the kind of information technology that we are using, although progressive groups like ours at Fortis have continuously evolved using the information technology domain, but I think even today, we are still at the tip of the iceberg as far as utilization of information technology is concerned. The future of healthcare rests a lot on the foundation of information technology that we set in today, because whether it is from a consumer connect point of view, from the healthcare consumer or the patient point of view, from a doctor's point of view, from the operating efficiency of the institutions, from the medical technology perspective, everything is IT enabled. Everything around medical technology revolves around information technology, and you can't segregate the two at all in today's time. So the way that I see it, I think information technology is going to be the foundation of healthcare enterprises in the future. It is going to be the foundation of good patient care. It is going to be the foundation of creating good and profitable and efficient hospitals.